Yes, thank you, Representative Johnson. I would say that, it sounds to me, and you did say that you want to see what happens down the road, so it sounds like we're kicking the can down the road again. But it seems like every time there's a tragedy with guns, whether it be Sandy Hook or what have you, I hear people saying that it's too raw or it's too recent, and so we can't do anything about it. But this has been going on for a multiple of years, and in the meantime, more and more adults and children are being sacrificed. I would think that was a really important issue. So I would ask you, as my representative, to please consider introducing a bill to, at least for the Capitol right now, to eliminate the possibility that people can bring guns or any weapons into there. And maybe in addition to that, some sort of metal detectors or something to detect these weapons so that they don't enter. Because you can't always trust people that they're going to do what the sign says. These signs say no weapons allowed, but people can still bring them in if there is no system to detect them. So I would ask you, Representative Johnson, to please consider putting together a bill to introduce when the House gets back into session, to do something about that. That's a start, at least, I think. Because we can't keep saying just because every time something happens, someone's shot to death in cold blood and premeditated, that these things we're all too upset, and we have to have our minds clear to think about this before we do anything. Because by that time, that whole feeling is gone, and the sentiment, and nobody wants to take action. But then again, there's several more things that occur. So what do you think about that?
Well, two things. We have to remember, we're not in session now until February again.
Yep.
So if certain federal actions happen, we will have to come back in session in probably September, October for that. That would then open the door for possibly something to be done at that time. What I'm saying is, I'm not an expert in law enforcement, security, all that stuff. We have many, in fact, even in the Republican Party, we have retired police officers. We have a police chief that's in the House. We have retired, I know, and stuff like that, that I know have the expertise to bring in what would be workable. Somebody like me that doesn't know what I'm doing, I would be working with them anyway. I'd be reaching out to them. So I want to see what other people who have more knowledge in it and have the expertise in it to do. It's no different than everything else. I relied on principals and teachers to tell me what schools need. So I'm just relying, so we have to also understand anything that's done there, probably other than the metal detectors. The issue is then concealed carry, is that still available at the Capitol? And if they try to stop that, I expect there's going to be a court case over it, constitutionality of it. So that's going to be a longer term thing. So we're just not going to be able to flip a switch and say this is enacted, because we're going to have to get people involved. We're going to have to figure out how we get back in, how we do the bill, how we negotiate the bill, what happens with that bill. Then we have to figure out how far that bill goes, whether it makes it through the court system and stuff like that. What I'm saying to you is that I would support, depending upon, there's no other stuff, I don't know if you've been around, but a lot of bills they like to stuff things into that totally unrelated. If we see a bill that is specifically to take guns out of the Capitol, I would support that. Unless there's other stuff brought into it that are unrelated to that. Because I just don't think, I think they're, it's just, and again, some people will be mad at me, there's different associations. I just don't think with all the police we have there, the state patrol we have going through there, the sergeant at arms and all that stuff, and the county that patrols it, I feel safe at the Capitol. And I don't think other people need to have guns brought in. I don't think it's a place that needs to be done. So answer that. And what I found with politics is trying to make, again, it goes back to the hypotheticals. I have to see what is being presented to us and whether it's clean, so then I can decide, yes, I support that. And I saw this many times with the bills that we did this year. I wanted to support certain bills, then all of a sudden there was something in there. Example is, at the last minute they throw in a lot of fees, or they all of a sudden decide to raise taxes. I saw a good bill, but I made a pledge at the beginning, after what we saw in 23 and 24, that we did not need to raise more taxes and raise more fees. And if a bill came up and I was able to see it, I voted against it, unless it was really, really something else in there that I strongly felt we needed to do, and there was examples of that. Then I went and, bit my tongue and said, yes, I'm gonna do it. Because one thing down there at the Capitol, when you get in that politics, there's no absolutes. Sometimes you have to take the lesser of two evils. So that's the best I can do right now. So, go ahead, and then I'll go back here. Yes, go ahead.
Okay, so Republicans voted to remove illegals from Minnesota Care and getting health care going forward in 2026. What are you going to do about the hospital situation then?
That's a very good question. Thank you. Did everybody hear that?
Yep.
Okay. Well, she was wondering about, and the undocumented people being eligible for Medicare. So,
But what I'm really wondering about is, because I think we've talked a lot about the
Yep.
situation with healthcare in Minnesota, how it's greatly declined, and that has been proven. But with removing illegals, now the hospitals are saying, well, we won't get paid. Previously, the hospitals were saying, we don't want to cover these people. We don't want to cover Medicare. We don't want to cover Medicaid. We are not getting the reimbursements. Under the Biden administration, he lowered reimbursements every single year to doctors, basically. We are not taking care of our doctors at this point. We are not taking care of our nurses. And most importantly, we are not taking care of patients the way they've been taken care of in the past, which used to be the #1 place for healthcare in the United States, right here in Minnesota. It is not. The most recent studies with Becker's Hospital said we're the 4th worst in getting specialty care. And I'm here to tell you, it is true. If I have to go to a specialty care person and wait for a month for my insurance to even be submitted to insurance, that's wrong. Repeatedly, I have heard that there are staffing issues at every one of the places that I've been to. What are we going to do about staffing issues? Why don't they have them? What are we going to do about insurance, which of course has been supported heavily by lobbyists and Republicans, but what are we going to do about some of these insurance companies that are just ignoring what doctors are saying? I have talked to so many doctors and nurses where they know for a fact they have someone that's literally going to die if they don't get something, and they are not getting responded to by the insurance companies on a timely basis. And I will tell you emphatically, my own personal experience is that it's a joke. This has nothing to do with the nurses or the doctors. They can be the best quality, but what's around them is not the best today, and there needs to be improvement. And so now the hospitals are saying, oh my goodness, what are we going to do? We won't get those reimbursements because they are no longer getting Minnesota Care.
so I'm gonna try to chunk this up.
It's a lot.
It's a lot.
very complicated.
Back to the original thing when you said the Republicans. Now we have to remember the governor brokered that deal along with the Democrat leader, along with the Republican leader, and went along, put that all together. And that was a brokered deal that was then put on to us to say, we're going to accept this. I have been aware, and I have been torn and conflicted regarding this issue. And unfortunately, it's another big issue that should be dealt with at a different level. Immigration is a federal issue. And since they are not dealing with it, we are
But
being put back into
Governor
this.
Walz says we're a sanctuary. He has said we're a sanctuary state. The majority of people in Minnesota do not want that if they live outside of the Twin Cities. And so my issue is, it really is a state issue. We are a sanctuary state as far as I'm concerned. When you look at Minneapolis and St. Paul and Dakota County and how it's moving out to other areas, it's not what a lot of people want, and we've had a lot of people move out of the state or put their money to other states where they don't have to pay taxes because they're sick and tired of what's going on here. I happen to be one of those people. I'm literally at a point where I'm going, you know what? I paid enough in taxes. I paid for private schools. The healthcare, I'm like, and again, no fault of the doctor and nurses. I've talked to many of them. It's shocking what's been going on in healthcare.
So, just to be fair to everybody, because I feel that's important, Minnesota has not been declared a sanctuary state. In fact, he was just out at
They
Washington
run it like it
defending.
though. When you have people showing up at your door, when I have a private driveway, it says private. That means private. According to the law today, if I don't have my gate shut and locked, anybody can come up my driveway. It's a mile-long driveway, and they have. That's not appropriate. That's like I can go do whatever I want and bug whomever I want. I'm tired of being bugged. I am. For somebody to show up at my door and say, hey, are you making booze in your house? That's nuts.
What's that got to do with?
Healthcare, it has to do with the attitude of like we can be and do and say whatever we want and not follow laws. You are absolutely right. Just in healthcare alone, the number of laws that were violated that I had to call, and you were one of them in the end, legislators about how this isn't being followed, this isn't being followed, this is what I need to have done. To have to spend the amount of time that I have since 2016 contacting legislators to say, we're not following this law, we're not following this law, why are these not being enforced? To me, it's like, what is going on? Your biggest industry in Minnesota truly is, it's healthcare. If we don't take care of healthcare, we don't have much left. Your tax base has gone. I mean, if you look at the big companies, the companies that we had here in just even healthcare years ago, they've gone. They're gone. We need to start taking care of the industries that made us who we are, and then support the people that are in them, but most importantly, the patients. Oh my goodness, the patients need to be supported. Just because a medical director will pull me up and go, hey, yeah, I'll support you, I'll get you up to get care. I've been into emergency rooms where they're completely full. They're full. Who's doing something about this? I've sat in meetings with people who are running the hospital association, and they're like blabbing on, and I'm like, you know what? You just gave me a partial quote of what the truth is. And the truth is, patients are not being taken care of. And I'm one of them, and I have so many more that I could go through that haven't.
Okay, I respect you. I know we've had this conversation, and I know we ended up.
But now we're at the
spending about
hospital
an hour.
level.
I understand. So, what I want to answer is your first question, and I want to make sure everybody else get heard too, because
Yeah.
we're going to run out of time otherwise. The undocumented immigrant issue is one that was determined between leadership, and we were told that we're going to be passed. So that was both sides. I see it as an economic issue, as you said, that it's an issue that's going to put the challenge on hospitals that are going to put burden back in the emergency rooms. They're not going to be paying for the cost and all that stuff. I voted for it because we were told as a party we were going to vote for it.
We should have voted
Otherwise,
for it.
nothing else
In my
would
opinion.
have passed. The health care would not have passed, nothing would have been passed. Immigration issues should be taken care of at the federal level. If they took care of it at the federal level like they should, we would be dealing with it at the local level. To be fair, Minneapolis and St. Paul is a sanctuary city. I don't know of what counties. I know a lot of counties were being accused of being it, and they weren't. The issue that you have is a much longer discussion that
But it hasn't been
Unfortunately,
resolved for years,
I
and that's the
understand,
issue.
but
Yeah.
we also want to be respectful for everybody else that's here wants to ask.
And I have one more thing to say.
Okay.
Just one more thing, please. So the other issue that really is disturbing to me is that when I see my governor get up and start at the Minnesota Nurses Association get-together, call Republicans Nazis, I find this to be unacceptable behavior. And I don't understand why more people have not rallied around this issue, really. I mean, I know that they questioned him in Congress and everything, but I think more people need to rally around it because I find that offensive. My family came from Germany and they fled. And to sit and be called a Nazi and then have him publicly talk to groups like the Minnesota Nurses Association and say this, and it's on TV, it's videoed, is unacceptable. What is going to be done about this? This is our leader of our state.
What do you think we can do as representatives?
Well, you need to do something because it's unacceptable.
I agree, it's not right, it has been brought out, but unfortunately, here's the deal. You guys have the true power. You don't like a governor talking that way, you have an election coming up. That's really what it boils down to. We can't kick out the governor. We can't sanction the governor. We can't do any of that stuff. It goes down the level of free speech. Do I think he should have used that?
Free
No, I
speech.
don't. I don't.
That's
Phil.
inciting violence.
So,
As
Okay.
were the burning of our cities.
thank you.